streaming on YouTube.
All right. Well, I want to start with a great big welcome to everyone. Thank you so much for joining us this afternoon. Today is Friday, September 17th, 2021. We've convened the Board of Health for the New York City Department of Health and Mental Hygiene. It is 4:05 p.m. and I will call this meeting to order. To begin, I'll conduct roll call as usual. I'll ask, are the following members present? And please say here or yes after I say your name. Karen Redlener.
I am here, thank you.
Lynn Richardson.
Present.
Pamela Breyer.
Here.
Mitch Katz.
Here.
Rosa Gill.
I am here.
Sixto Caro.
I am here.
Susan Klitzman.
Here.
Joel Foreman. Dr. Foreman, are you on the line? I don't hear him as yet. And as Lisa had mentioned previously, we do have a new board member, Dr. Sidney Hankerson, whom I'd like to welcome in absentia. Unfortunately, he isn't able to join us for this board meeting, but we really look forward to having him for the next board meeting. And we'll do a warm introduction and make sure that, that everyone knows a little bit more about his background during that board meeting as well. We have a very robust agenda, so if you'll permit me, I'm going to dive right into the items on that agenda. But first, let's start with approval of the minutes from the April 13th meeting. Are there any corrections to the minutes from the April 13th meeting?
No.
I'm hearing none. May I have a motion to approve the minutes?
So move.
as distributed?
Second, even though it's usually Joel who has, Dr. Foreman who has the corrections, but okay. Second,
Thank you. I heard Rosa with the motion and Pamela with the second. All those in favor?
Aye.
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 Thank you. Any opposed? Okay, the minutes from the April 13th meeting are approved as distributed. Thank you again. The first item on the agenda is the notice of adoption to amend Article 173, hazardous substances of the New York City Health Code regarding lead-based paint. Our presenters are Christopher DeAndrea, the Assistant Commissioner for the Environmental Disease and Injury Prevention, and Andrew Fasciano, the Executive Director of the Healthy Homes Program. I will now turn the meeting over to Chris and Andrew. Thank you.
Great. Thank you very much, Commissioner. Next slide, please. Thank you. Just a quick summary. At the April 13th meeting of the New York City Board of Health, the department presented a notice of intention to amend Article 173 of the New York City Health Code. Just to refresh, the NOI included amendments to specify that the department can inspect a supplemental address for any child under the age of 18 with a blood lead level of 5 micrograms per deciliter or higher, and define such addresses as locations where a child spends 5 or more hours per week. And also to include certain childcare settings in the definition of an unsafe lead paint hazard, which has an action level of 0.5 milligrams per centimeter squared of lead in paint. The board approved the NOI for publication with comments. The NOI was published in the New York City Record on April 20th, and the public hearing was held on May 21st. We did not receive any written comments and no one testified at that hearing. At the April 13th meeting, members of the board commented on the use of the different age thresholds for departmental investigations proposed in sections 173.13A and 173.13D1 of the Health Code. The former using the age of 18, while the latter used the age of 6 years of age. Similarly, the board commented on the use of the phrase primarily, focusing on that word specifically. So the phrase primarily used or occupied by children under the age of 6 years, which appears twice in section 173.13D1 as unnecessarily limiting the department's scope of authority to investigate locations. After consideration, those changes have been made to clarify and provide greater protection to New York City's children. The phrase now in 173.13D1 reads, used or occupied by children under the age of 18 in both instances. So the word primarily was dropped. And that summarize those are the changes that we made, and happy to take any questions.
Thank you very much, Chris. So at this time, as mentioned, we'll take questions from the board. You can either raise your hand virtually or physically or both, and I'll be sure to call on you. First, Dr. Susan Klitzman.
Hi, good afternoon, and it's nice to see everybody, and thank you, Chris, for that recap. Just for the record, I wanted to reiterate that at last board meeting, I did ask if the department could provide the board with some more data on the extent of the issue, the extent to which you find supplemental addresses with lead-based paint hazards in the homes of children or other addresses of children with elevated blood lead levels, both the current situation and the trend. So I realize a lot has been going on since April and that this is nowhere near, at least in my opinion, the most pressing public health priority, but still, I think it would be helpful for us to know the extent of this issue. Thank you.
Yes, thank you. So we have been working on an answer to that question, and we should have an answer to the board shortly. So we've taken some time, and it's a bit more extensive than simply running through a table. So we'll have something for the board shortly on that.
Thank you.
Thank you. And I see Karen Redliner's hand raised as well.
Yes, thank you. Hello, everyone. As I know, I don't know if people recall that, but I was one of the contributors to the conversation in the April board meeting about some of those details in the notification. And I just want to say that I think that you and your team, Chris, have done an excellent job of incorporating our comments and clarifying some of those points that we discussed. I think this is a very good outcome, and I move, if appropriate, to accept this and move forward with this new policy.
Thank you very much, and certainly appreciate those comments and recognition of the work by Chris and the rest of the team. And thank you for raising the comments in the first place. I'm just going to scan to see if there are any other questions before we move forward with Karen's motion. And I don't see any. So may I have a second in terms of the motion to approve the notice of adoption to amend Article 173?
Second.
Thank you, Susan. I'll now take a vote from each member. Dr. Lynn Richardson.
Aye.
Pamela Breyer.
Aye.
Mitch Katz.
Yes.
Rosa Gill.
Yes.
Sixto Caro.
Aye.
Thank you. And has Dr. Foreman had a chance to join us? I don't hear or see him. So I believe that gives us a vote of 7 out of 9 in favor of the motion, unanimous among participants of the board meeting today. So the motion carries.
May I just say one thing here?
Of course.
I want to say thank you to Karen, certainly, and to Susan for really the great support and smart questions, and you really helped me focus on what the issues were here. So thanks very much. In addition to the great staff, of course.
Thank you for that comment. All right, we'll move onward with our agenda. And I intend to just set the scene for the orders that we'll be discussing for the remainder of the board meeting. I wanted to start with these vaccination updates, which certainly reflect a significant amount of progress made in New York City. I'm proud of the role that the health department has played, really in partnership with so many across the city, and particularly with the healthcare sector to vaccinate New Yorkers. As of today, we have over 5.1 million New York City residents who have been fully vaccinated. And since the inception of our vaccination campaign, 11.1 million vaccine doses have been administered in New York City of the COVID-19 vaccines. We're somewhat used to these numbers, but I think it bears remarking that, that this is truly historic in terms of its scale and its scope. I also wanted to mention that it's not just about those numbers, it's about the very tangible effects that the protection of vaccination affords. The health department collaborated with Yale University on a study that showed that as of June 15th, 2021, New York City's vaccination efforts have prevented about 250,000 COVID-19 cases, 44,000 hospitalizations, and over 8,300 deaths from COVID-19. So this is truly life-saving work, and those numbers are likely to be conservative estimates, given that since June 15th, we've been in another resurgence of COVID-19 due to the presence of the Delta variant. I also wanted to make sure to share with board members some of the work that we are doing to, in real time, analyze the effects of vaccination. And so, for example, this is something that was recently added to our data pages, all of which you can peruse at on.nyc.gov/vaccine data. But this particular graph highlights the major difference in risk of hospitalization due to COVID-19 for people who remain unvaccinated versus people who are fully vaccinated. It's at least a 10 times difference in risk between people who are unvaccinated and vaccinated. And I think underlines the sense of urgency that we all feel with respect to further extending the benefits of vaccination to as many people across New York City as we can. Next slide. Our strategy and the city's strategy is summarized here, which boils down to first, lowering barriers to access, second, ensuring that we have incentives and supportive policies that also increase vaccination uptake, and then finally, where it is justified, particularly in the name of public health, to move to vaccine requirements in specific settings, and particularly to protect people who are vulnerable, including those who are at high risk of severe illness or death. So this is the scaffold that we've used over the last several months, and I'll describe each in a bit more detail now. First is increasing vaccine access. This is really about ensuring that we have done everything that we possibly can in terms of supporting education and outreach, reaching into the communities and the neighborhoods that have been hardest hit by COVID-19, doing so in the languages that our fellow New Yorkers speak, using trusted community partners, whether they are community-based organizations or the healthcare providers in specific neighborhoods, and making sure that we are empowering them with the science-based information to have conversations about vaccination. I am proud to say that since the beginning of our vaccination campaign, we have had a vaccine equity strategy, and equity has been a core pillar of our efforts, along with the hard-nosed focus on the outcomes that I described. Over the course of the campaign, we have been nimble in adding vaccination sites across the city, particularly looking at areas where we know that access was a problem, and then subsequently in areas where there were lower vaccination rates. One example of this is all of the work that we've done to provide in-home vaccination to anyone who is eligible for a COVID-19 vaccine. As of the summer, any person who is 12 years or older was eligible for in-home vaccination, which I think is emblematic of the lengths that we believe we should go to lower barriers to access to vaccination. Next slide. Second is incentives and supportive policies. Many of you may be aware of the $100 incentive in terms of prepaid debit cards and other ways of reaching people, particularly using incentives to get, again, to harder to reach populations, whether it's in specific parts of New York City or in specific demographics like younger New Yorkers. We also started the New York City Vaccine Referral Bonus Program, which incentivizes community and faith-based organizations to refer their clients to get vaccinated as well. And just last week, we launched a new program which provides reimbursement for healthcare providers, for clinicians who are reaching out to patients who are not vaccinated. This was the latest chapter in our Use Every Opportunity campaign, working hand in hand with clinicians across New York City. Next slide. And I'll wrap up my section and pass the baton to our General Counsel, Lisa Landau, just to say that this is the groundwork and this is the work that has been done over the last several months that has led us to this point for us to implement vaccine mandates, as we'll describe in some more detail now. Over to you, Lisa.
Thank you, Commissioner, and good afternoon, board members. Very happy to see you all virtually and glad we have this opportunity together today virtually. So let's go to the next slide. So the next part of our meeting is really focused on the recently issued commissioner orders. There are 4 of them that mandate vaccination in key areas. And given the current vaccination rates in the city and the reopening of schools, these commissioner orders really reflect necessary steps in the landscape of increasing vaccination rates in New York City, and particularly with an eye towards the most vulnerable in the city and our own capacity as the city, the Department of Health, to ensure that our own staff and contractors really walk the walk in this realm. I also want to underscore the powers of the department, the commissioner, the Board of Health. The department is authorized to supervise, I think as everyone knows, the control of communicable diseases and can take actions as necessary to protect public health. In particular, the department is authorized to adopt vaccination measures in order to prevent spread of communicable disease. I also want to underscore that all of these orders are in the context of other legal requirements. So namely Title VII, the Americans with Disabilities Act. So while those particular laws aren't necessarily mentioned in the commissioner orders, they are certainly in our legal context, and the ability to afford employees, students, the opportunity to make requests for accommodations exists, notwithstanding no specification in any of these orders necessarily. So let's go to the next slide. So our first commissioner order issued in early August, requires that residential and congregate setting staff and personnel be fully vaccinated against COVID or submit to weekly testing. This order applies to staff at locations where city-operated or contracted services are provided in a residential or congregate group settings, including homeless shelters, domestic violence, HIV/AIDS shelters, jails, correctional facilities, senior centers, and retirement communities operated by the Department of the Aging. And so, certainly the idea here is we want to ensure that the staff there is protecting what can be vulnerable populations, as we can all acknowledge. These are group settings. We have an increased risk of severe COVID for many of these populations. And of course, we have the more dangerous Delta variant, which accounts for nearly all sequenced cases in New York City and is more than twice as infectious as prior variants. So all of these together really underscore the need to address our own staff in these organizations and contractors for these agencies. So we ask that the board ratify the August 10th, 2021 order of the commissioner. We're happy to answer any questions that you might have.
Thank you very much, Lisa. I see Karen's hand raised.
Thank you, Commissioner. I am very interested in these commissioner orders and ratifying them. But I do have a question that I think would help us put the need for mandates in some kind of context, or at least give us some information about some of your access and incentive efforts and how successful they've been, or how well they've been received. I was interested in understanding if you have a number of, for example, how many people requested in-home vaccinations, or how many people benefited from the financial incentives that you offered. Is that something that people, I'm just sort of interested, is that something people were receptive to and it boosted the numbers, significantly, or is it something that, was offered very, creatively, but didn't see such an uptake?
Thank you very much for the question. Here's what I can tell you, and we can follow up certainly with more specific numbers. But the short answer is that yes, we do believe that that all of the programs, and of course taken together, have had a very significant impact with respect to uptake. I'll give you the specific numbers for first and single doses that were administered in August. When many of the things that we're discussing today, as well as those additional initiatives around access and incentives, were brought to bear, together, and that number is about 460,000 first or single doses, which was a very significant increase compared to the number of first and single doses administered in July. Importantly, from the equity perspective, we've also been very aware that vaccination rates are different among different demographics, and particularly among Black and Latino New Yorkers. And in August, we saw that 60% of those first and single doses that I mentioned, that over 460,000, were administered to Black and Latino New Yorkers, which helps us to close those gaps, which were very important from an equity perspective. In terms of in-home vaccination, I know that the number is tens of thousands, but I don't know the precise number. And in terms of the $100 incentive, I believe that was approaching 100,000 people who availed themselves of that particular incentive, but those are specifics that we can follow up on. Thank you again.
Thank you for that information. I think it helps us, understand the landscape of where we are in the city, and for the increasing need to also move forward with mandates. Thank you.
Are there any other questions?
Yes, yeah, wait, what, yes, there are. Oh, wait.
I see. I see Pamela and then Susan. Pamela, why don't you go first?
Thanks. Hang on a sec. Am I off mute? No, I'm not. Okay,
Yes, you are. We can.
Yeah,
hear
we
you.
can hear you.
good, perfect. So it's not, maybe it's not immediately relevant for this, but it is related. But I do want to say first that the data that you have, Commissioner, and the results are spectacular. And you all are to be congratulated for your tireless efforts in accomplishing this great data. I'm thinking about this third shot issue, which is not ready for prime time to be mandated, but which does contribute to infection rates. And I raise it just in part to flag it for a future discussion, but also because I think there's some, I think different entities are doing what they think is right that maybe is not being mandated or recommended by the health department. And I think there may come a time when we want to mandate that. I mean, I know not now, but I just want to get that. I don't want to divert the discussion, but I do want to put that on the record so we can come back to it either at this meeting or the next.
Thank you for that comment. And I agree, it's an important one and one that we are thinking about carefully. For the purposes of the orders that we're discussing this afternoon, full vaccination is defined as 2 doses of the mRNA vaccines or 1 dose of the J&J vaccine, as I know you're aware. But just to clarify that part, but I agree with your flagging of that future policy issue. Thank you. And Susan, you have your hand raised, please.
Yes, thank you. So I also want to second Pam's appreciation of all of the department's efforts. I enjoy seeing you on TV, speaking from both a public health and a personal perspective about the importance of vaccination. I think that is very effective. Many of my colleagues have spontaneously appreciated that, as well as all of the community-centered approaches that you're using. And I know we're not out of the woods yet. I know there are a lot of challenges, but I do want to say that, we at CUNY were very concerned about how our fall semester would go. For the first time since the epidemic, we began having students taking in-person classes, and students have to be vaccinated or show a negative PCR test taken within the past 7 days. And out of our population, we have a very good rate of compliance. And in fact, for the first month of school, the rate of positive COVID tests of people coming to campus is about 0.3%. So, that to me is some evidence of the effectiveness of the department's campaign and everyone else's efforts toward this. And, it helps us breathe a sigh of relief that our students can come back safely and return to some degree of normalcy. So much appreciation on behalf of all of us for that.
I really appreciate that. Thank you for sharing it. And I have to acknowledge, of course, all of the health department staff who have been working truly tirelessly, not just over the course of the vaccination campaign, but over the entire duration of the pandemic. And I'm so grateful for their work and the sacrifice that it's entailed, and particularly for the vaccination campaign. Have to acknowledge how many partners we've had in the community and particularly clinically as well. All right, I see many more hands raised. So I saw these in the order of Karen, and then Rosa, and then Sixto. So we'll go in that order. Karen, please.
Thank you so much. A quick question relative to this particular order and how it compares or contrasts to the next orders that we're going to be talking about. And I may have misread this, but is it accurate to say that this order, which deals with requirements for staff in residential and congregate settings, is mandating vaccine or a weekly PCR test. But the other orders that we're going to be talking about are just requiring vaccination. So if that's the case, I just wanted to, kind of bring that to people's attention and ask a question as to why we, allowed a testing option in this group, but not in the other groups that you provided an order for.
Lisa, do you want to start on this one?
Sure, I'll start and turn it over to the commissioner if need be. Just to say you're absolutely right, Karen, that this is a vax or test option. It feels like ancient history, August 10th, a long time ago, with a lot of, and this the commissioner can speak to, a lot of Delta variant increases across the city. I should say that, this was the first effort, really, the congregate care residential setting was one of the very first efforts to begin down this road. And the idea was to, then move it into a broader group. So now all city employees also through a mayoral order have to either test or vax by the same date as the teachers. I mean, it was all part of moving the ball forward incrementally. And so this was, in fact, one of the very first. And really, as we'll talk more through the next few orders and slides, when we're talking about going back to school and children who cannot be vaccinated, unlike people in congregate care and residential settings who have the option, there have been enormous efforts to offer vaccination at the locations where these residents are. And notwithstanding that, we still have some work to do, but we can do what we are able to do, which is to ensure that the staff is protecting the people that they work with. And so that's the idea, sort of moving from sort of this more generous, I suppose, standard of vaccine or tests and to more rigorous vaccination for those teachers, as we'll talk more about in a few moments, who are taking care of children who many of whom are not able to be vaccinated. And the same holds true in the child care setting. So kind of taking these all step by step. Commissioner, would you like to add anything to that?
No, thank you, Lisa.
Well, thank you for that explanation. And I know this is an evolving situation, and we may see other commissioner orders moving forward as things change and update. So I appreciate it. Thank you.
Thank you, Rosa.
Commissioner, good afternoon, and everybody else. First of all, thank you so much for your leadership these challenging times in public health. Indeed, the rate of vaccination is impressive. I also want to thank H&H, Mitch Katz, and our colleagues at H&H for that partnership in helping New Yorkers to get vaccinated. I don't know, probably not in this meeting, but maybe in other meetings, Commissioner, can we get a little bit of data and focus on the Latinx community and the African-American communities in terms of rate of vaccine and efforts that we have done? And I am particularly interested to know how we're doing with the vaccination of children 12 years up, and see what's happening in that area, particularly with the Latinx and the African-American children. Thank you.
Thank you for that very important question. And yes, we'll be happy to figure out the right forum to discuss that in detail. We do on our health department website have breakdowns by age, cross-matched with race, ethnicity, and also by borough, by zip code level in terms of vaccination rates. So we do have some of that data publicly available. What I'll say at a high level is that we have made progress, particularly over the last 2 months, in terms of improving vaccination rates for Black and Latinx New Yorkers. but they are still generally lower than our citywide rates. And so we have to keep a focus on it, as you're calling attention to.
Thank you, Commissioner.
Sixto, I believe you were next in the queue.
Yes, I just want to congratulate the Department of Health for all the expo and to any communication that will get to all of us who are in the trenches, seeing patients primarily in minority community, like the Hispanic, Latinx, even in the Jewish community in Williamsburg, where I am, I was approached by some of my Jewish patients, some Hispanic teachers and patients, and African American, some of the Haitian, and any communication that will help us to reinforce to each of those members of the community through church, teachers, professional at all levels to keep helping us, because communication and data help us to counteract so many misinformation that is in the community and distrust of the scientific information that we can handle about. Thank you. Thank you.
Thank you so much, Dr. Caro. It's very well said and appreciated. And you know, you're emblematic of so many clinicians who have been working on the front lines in very challenging circumstances, you know, over the last 18 plus months. So I'm grateful for your leadership. And thank you, Rosa, for also mentioning health and hospitals. Dr. Katz and his team have been integral partners, not just for our vaccination campaign, but for the entire COVID-19 response. So we're very grateful for that. Are there any further questions? I don't see any. So before I call for a motion, I just want to correct the record on one thing, which is the question about incentives and the uptake of incentives. I had estimated it as about 100,000. That is a significant underestimate, I'm pleased to say. I'm rather to have underestimated rather than overestimated it. It's about 165,000 that have been taken advantage of thus far. So certainly an indication that they are helping us with increasing vaccination rates.
Great.
And I want to welcome Dr. Foreman, who has joined us as well, also seeing patients, and we're grateful that you're able to join us. So with that, if there are no further questions, may I have a motion to ratify the order of the Commissioner for staff in residential and congregate settings?
So move.
Thank you, Rosa. And may I have a second?
Second.
Thank you, Pamela. I'll now take a vote from each member. Dr. Joel Foreman, if you feel comfortable taking a vote based on your understanding.
I do. I read it and I do vote yes.
Thank you. Karen Redliner,
Yes.
Lynn Richardson,
Yes.
Pamela Breyer,
Yes.
Mitch Katz,
Yes.
Rosa Gill,
Yes.
Sixto Caro,
Yes.
Susan Klitzman.
Yes.
Thank you. With a unanimous vote, the motion carries. And I'm going to turn it back to Lisa to present the second Commissioner's order.
Great. Thank you, Commissioner, and thank you, board members. On to Commissioner Order number 2. This order is focused on Department of Education employees, contractors, visitors, and others who are working in the Department of Education and charter schools. So just kind of following through in what we talked about a few moments ago with Karen's question about moving from test and vax to vax only, and this is the order that begins from.
Where is your way?
I'm sorry, just missed that. Okay. On September 15th, our commissioner signed an order requiring the Department of Education staff and other personnel working in school settings provide proof of vaccination against COVID-19 by September 27th. And those same requirements are for charter school staff as well and other personnel working in charter schools. Visitors at Department of Education buildings and charter schools must now show proof of vaccination for entry. And as noted, the order does not include a test out option and applies to full and part-time staff, interns, and volunteers. Next slide, please. And I think we are all understanding of this rationale, the need to protect students, many who are not old enough to be vaccinated, as we talked about a little bit ago, wanting to keep schools open, to meet the educational and other needs of New York City children. I think that's been emphasized over and over. New York City did an amazing job last year in the springtime, with DOA and DOH staff doing everything possible to keep classes open and to protect students and teachers. And we're talking about settings that have an increased risk of transmission, certainly, and the presence of the Delta variant. Next slide, please. So we're asking that the board ratify the September 15th order of the commissioner, and we're happy to take questions from any of and all of you.
Dr. Richardson.
Thank you, Commissioner. So I noticed the language about partial or fully vaccinated in part of the order, and completely understand that at the beginning of the issuance of such an order, that makes perfect sense. But is there a point at which partial vaccination will no longer be acceptable? Is there some time period during which people are expected to become fully vaccinated?
Yes, thank you. They have 45 days within which to receive the second vaccine. So the idea is, moving along, progressing.
Thank you.
Yeah.
Thank you very much. Are there any further questions? I don't see any, so may I have a motion to ratify the order of the commissioner for DOE employees, contractors, visitors, and others?
So moved.
Second.
Thank you. I'll now take a vote from each member. I didn't catch who moved and seconded, so I'll go through everyone. Forgive me. Joel Foreman.
Yes.
Karen Redliner.
Yes.
Lynn Richardson.
Yes.
Pamela Breyer.
Yes.
Mitch Katz.
Yes.
Rosa Gill.
Yes.
Sixto Caro.
Yes.
Susan Klitzman.
Yes.
With a unanimous vote, the motion carries. And I will now turn it back to Lisa to present the third item on the agenda, order of the commissioner regarding participation in high-risk extracurricular activities.
Thank you, Commissioner. So relatedly, in the school context, we want to encourage, of course, students to participate in extracurricular activities, but there are some extracurricular activities that are high risk. So this commissioner order is meant to ensure that students who are participating in these high risk extracurricular activities are vaccinated to be able to participate. So we're talking about high risk sports, wrestling, football, volleyball. We're talking about extracurricular activities that involve increased exhalation of chorus, band, musical theater. And in each instance, those students must receive the first dose by September 27th for activities starting in September and October and become fully vaccinated within the applicable schedule for the type of vaccine received. Next slide. And I think many of us are very familiar with the CDC's concerns about high-risk sports and extracurricular activities, and issuing guidance about participants being fully vaccinated. The New York State Education Department stepped forward as well to issue recent guidance, recognizing the importance of having these opportunities for children, but making sure that these students participate, being vaccinated and protecting each other from risk. So we're asking that the board ratify the September 15th order of the commissioner. And I'm happy to take any questions.
Thank you. Karen?
Thank you. I fully support this commissioner's order. I just have a couple of questions about on page 3, where we talk about mitigation measures for children who are not eligible to be vaccinated. So it talks about, you know, at this point, the age obviously of possible vaccination is 12 and above. So, you know, requirements for high risk extracurricular activities for that age would be vaccination. And then it says, and those children not eligible to be vaccinated because of age, schools must implement mitigation measures. And it doesn't really specify any details about mitigation measures. And I'm just wondering, I know this is already, you know, sort of ruled and we're voting on it, but I'm wondering if schools would benefit from having more specific recommendations about what appropriate mitigation efforts are for those children that are not vaccinated.
Yes, thank you, Karen. As I understand it, the Department of Education is providing guidance on that very issue. So just to say that we can stay tuned to see that. I don't know that they are finalized as of this moment, but I know from many conversations with colleagues at the Department of Education and working this through that there are efforts that are underway to ensure that there'll be guidance on those issues.
Maybe in the future we would say, you know, per the Department of Education, you know, guidance or something like that when we have that in there. Just it seems a little vague. So thank you for that. And the second question has to do with when vaccines become available for children younger than the age of 12, which hopefully will be later this calendar year. Will this automatically apply to younger children, or do we need to, you know, do something more specific for that scenario?
I'm going to say that I think this was meant to be flexible enough for it to apply to those that are under 12. I have a colleague available from the Department of Education, and maybe she'd want to let us know the answer to that. Tony Gantz is with us from counsel's office.
Hello, and thank you. So the way that the order is currently written, it's DOE students. So it doesn't actually specify in terms of defining participants that they're students ages 12 and older. But of course, the mandate applies to those who are eligible to be vaccinated. So yes, I read this as saying that when additional age groups are eligible to be vaccinated, this would apply to them. Of course, it's those who are participating in high risk extracurricular activities. A lot of those types of activities are probably more often middle school and high school students as opposed to the elementary school students. But yes, that I do think that this would extend once additional age groups are eligible.
I see. That makes sense. Thank you.
Thank you for those questions. And I saw Joel's hand was raised as well.
Thank you. I took it down because Karen asked the same questions. I was going to ask those exact two. So thank you.
Sixto.
One simple question, technical. If an extracurricular sport, if a student is 11 years old or 11 or 10 years old, can they play or participate in sport of high risk as the other of 12 years old or older, because they are not vaccinated.
Right, and the understanding is that they would be able to participate with the mitigation efforts underway, and turning 12 is right around the corner. So for that very narrow group of students, that they would undergo safety requirements, they'd be subject to safety requirements and would be required once they turn 12 to be vaccinated.
Thank you. Are there any further questions? Okay, I'm seeing none. So may I have a motion to ratify the order of the commissioner regarding the participation in high-risk extracurricular activities?
So moved.
Second,
Thank you very much. I'll now take a vote from each member. Joel Foreman,
Aye.
Karen Redlener,
Aye.
Lynn Richardson,
Aye.
Pam Breyer,
Aye.
Mitch Katz,
Yes.
Rosa Gill,
yes.
Sixto Caro,
Aye.
and Susan Klitzman.
Yes.
Thank you. With a unanimous vote, the motion carries. And I will now turn it back to Lisa to present the final item on the agenda, the order of the commissioner regarding individuals working in certain child care programs.
Thank you, Commissioner. So for our fourth commissioner order of the day, on the theme of protecting our children who cannot be vaccinated, Commissioner signed an order on September 12th requiring the child care programs under contract with the Department of Education or with the Department of Youth and Child Development exclude from premises any staff who do not provide proof of vaccination status by September 27th. So this is a full vax commissioner order, and the order applies to DOE contracted early care and education programs, including UPK, 3K, Early Learn, Birth to 5, 4410 Special Education Services, Family Child Care supported through Family Child Care Networks, DYCD contracted after-school programs, the Beacon program, the Cornerstone program, to name a number of them. Next slide, thank you. Again, the rationale here is we're striking the same chord, keeping children too young to be vaccinated safe. The Department of Education and DYCD offers the majority of no-cost childcare and after-school options in the city. And all of these programs are funded by the city, and many serve school-age children who attend public school. Beginning with this population of providers allows the opportunity to extend the Department of Education-related school order to children who may overlap in settings, while using this as a chance to build upon the public health need for non-subsidized providers. So this is really the first rung of walking down the childcare avenue, I suppose, or up the ladder, something like that. So we're asking that the board ratify the September 12th order of the commissioner.
Thank you again, Lisa. And I see Karen's hand is raised.
Yes, thank you. Thank you, Lisa. And maybe your comment about walking up the ladder is kind of what I was going to ask about. So this order applies to all DOE and DYCD contracted facilities. So that means that private pre-K daycare facilities are not included in this order. Is that correct?
That is correct.
And
I don't have the contracts with the city. That's correct.
right. So is there another mechanism that can be brought to bear on those where mandates can be required on that, that category of daycare or preschool programs?
No, understood. So again, this is starting where we can start, which is clear. Our own contracted agencies and a very large section of childcare is covered by this order. But I think you're asking the question that I'm sure others are interested in, which is what about the rest? And that's, you know, true in this realm and in other realms as well, where we're starting with our own city employees, city contractors, and then moving from that position to the next position. So certainly something that is being contemplated currently, but starting with this not insignificant number of entities that are being required to fully vaccinate.
Understood. Okay, thank you.
Thanks, Karen.
Are there any other questions? Lynn?
Well, I'm certainly completely supportive of this action being taken, but I do want to understand the date of the order was September 12th. Is that correct? I just want to make sure I have the dates right. No? Yes. And
Sorry, yes.
And people must be fully vaccinated by September 27th. That actually limits your options for full vaccination. So I just want to ask whether that was intentional or because it would seem if the first time people became aware that this even might be required was September 12th, there is not time to take any of the vaccines that required 2 doses.
Right, right. So just to be clear that the same kind of walk is being walked here, which is that full vax, mandate is taking place, but on the 27th, an employee must show proof of vaccination, full vaccination, or it can be the first dose in the process. So I apologize for any lack of clarity there. It's spelled out in the.
I apologize. I did not read all of the orders, but just based on what was on the slides, I wondered about the timing of it. But
yeah, so we
want to give people the opportunity to comply.
Exactly. Thank you.
Thank you for the question. I see Susan's hand raised now.
Yes, thank you. And I just want to confirm that I read and understood this and the other orders correctly. There's no mention here of potential for religious exemption. Is that correct?
No, that is not correct in that the context in which these orders are being promulgated is, full adherence to federal, state, and local law. And for employees, employees are entitled to request accommodations for medical reasons or for religious reasons. So under Title VII or under the ADA. And so that is part of the legal framework of each of these orders.
And
Thank
so,
you
Lisa,
so much. Yeah.
So Lisa, this is the litigation that is has a TRO subject to ruling by the court.
There is a TRO in place until September 22nd with respect to one action brought by a number of unions, and that is really focused on the mandate, the complete mandate.
No, I guess my question is, once that is resolved, and I know we can't talk about it today, will the board be convened to vote on it?
Well, we're convening today to vote on that very commissioner order that is at issue because it is not stayed. That the process of approving the order is not at all deterred by the action that's ongoing in court.
All right. I must have misunderstood your email. Okay, that's great. Good.
And just to be clear about it, that was the second order. That was the DOE commissioner's order, which the board has approved.
know that. All of a sudden, I realized that that was the litigation that was being contested. Okay.
Okay, are there any further questions? If there are none, may I have a motion to approve, to ratify the order of the commissioner regarding individuals working in certain childcare programs?
So moved.
Second,
Thank you. I will now take a vote from each member. Joel Foreman,
Aye.
Karen Redliner,
Aye.
Glenn Richardson,
Aye.
Pam Breyer, Pam, you may be muted. We'll come back to Pam. Mitch Katz,
Yes.
Rosa Gill,
yes.
Sixto Caro,
Yes.
Susan Klitzman,
Yes.
and circling back to Pam Breyer.
Yes. Ha. Yes. Sorry. Sorry.
No problem. Thank you so much. With a unanimous vote, the motion carries. Well, thank you to all of the members of the Board of Health. I want to sincerely say I'm so grateful for your work on behalf of New Yorkers to help protect the health and the welfare of our city. I know so many of you are doing it, not just in your roles as board members, but in so many other myriad ways as well. It has been a very busy period for the health department, so we're grateful for your keeping pace with us and working through the agenda items for today. Thank you again for making yourselves available this afternoon, this Friday afternoon, and I wish everyone health and safety. We are now adjourned. Thank you.
Thank you, Commissioner.
Thank